There's all this talk in the media the last few days, the last couple of weeks, about Ebola and the growing presence of Ebola, especially on the western side of Africa. Internationally, people are concerned. What is Ebola exactly?
Ebola is actually an RNA virus. What we call RNA is basically, most of our cells have DNA. RNA is used to produce proteins, and there are different types of viruses, but this one, the Ebola, it causes your body to have what we call DIC, which is disseminated intravascular coagulation, which basically means that you get a lot of blood clots in your small blood vessels. When that happens, it eats up all of the normal clotting factors in your body, and so eventually you start bleeding from other areas without any stimulation. So basically you can get bleeding into your gut, bleeding through the skin, all these sort of things.
That sounds terribly scary.
It is a bit scary.
Ebola's been around a long time. We've known about it. Yet over the last few months, there's been a growing concern about the possibility of an outbreak, not just in that area of Eastern or Western Africa, but around the world. Should we be concerned?
The short answer is probably not. There's really not. I mean, there have been a lot of different other viruses which cause hemorrhagic fevers similar to Ebola, including one called Marburg virus, which is actually a town in Germany where it just didn't have such a high mortality, but it's related to the Ebola virus. Now, Ebola is usually concentrated in West African areas, anyways, and most of the time when it is spread, it's not that easy to spread it without actually coming into physical contact with body fluids. So, and if you consider that there's now been almost about 800 deaths from Ebola this year, that's higher than any other year that's ever been recorded. I mean, the first Ebola outbreak was first recorded in 1994. And it's based on a river in the Congo called the Ebola River. And there were most of the outbreaks which happened were probably in the region of about 200 or 300 people, and it's usually restricted to those areas. The difference now is that a lot more people are traveling. You can get the virus can travel a long distance, and unfortunately, the virus only shows its symptoms anywhere between, usually it's between 38 and 72 hours, but it can take up to 3 weeks before it actually starts presenting. So obviously somebody could get contracted, travel to a distant place, and then theoretically they could be transmitted to somebody else in that area.
So if I'm a business person traveling into Africa or across the continent, African continent, I'm coming into contact with people who may or may not have the Ebola virus. What should I be concerned about? You spoke about contracting the virus through physical contact with body fluids. What should I be concerned about? Sweat, spit, what can I do? What should I not do?
Okay, well, first of all, it's never been recorded to have been spread by aerosol. In other words, coughing, sneezing, you can't pick it up from that. You actually have to physically touch some body fluid. That would be blood, semen, saliva. It can happen if you get enough of saliva, but it doesn't usually transmit very well through saliva. But a lot of the transmissions that have happened are mainly because the patients, the people who have come into contact, have either had physical contact with any of these fluids, particularly blood and semen or vaginal fluids, but also from eating foods which have not been prepared appropriately, and particularly foods such as bush meat and things which we don't know where you're getting them from. We don't know exactly what the vector is. In other words, we don't know where most times when you have a virus, you need to have some vector which keeps the virus but the vector doesn't get sick itself. Otherwise, it would kill its own host as well. They think it might be the fruit bat and some other things, but the point is that even animals, which a lot of other primates also can contract Ebola, and they also can die from it. So if you are eating, for example, if you are going to be trying some delicacies overseas, over in the West African coast, you should be a bit careful, because most of the time, most prepared meats will not contain Ebola. But if you're going to be trying any of these game foods and things like that, you might be able to get it from that. The second thing is really contact physical with people who have the virus. And as I said, unfortunately, the virus can actually, even when the patient has recovered from the virus, they can still be transmitting. So again, I think it's pretty much basic normal hygienic processes that you do when you're going overseas. Make sure that you're fully vaccinated for all other conditions. Make sure that you're taking your specifics such as anti-malarials. For example, if you consider that there have been now 800 deaths from Ebola, but on a daily basis 2,000 people die from malaria every day. So it's it's just a matter of normal precautions that you're taking. When you get to the venue, wherever you are, try to avoid eating things that you don't understand. Make sure that the food is well cooked. Avoid contact with anybody who's having open sores, bleeding, and that sort of thing. Wash your hands regularly, and that is standard policy as far as preventing a lot of other physical diseases. Do remember, of course, that even when you use these alcohol rubs and alcohol gels, they only kill the viruses for about 3-4 minutes. So I'm not saying that you have to spend all your time rubbing your hands, but if you do come into contact with somebody and you're a bit worried, then do make sure you probably have an alcohol rub just to keep your hands clean. Then make sure that when you are traveling, if you do know that there's an area where there's a specific problem, maybe try to avoid that area. I think it's just a matter of being generally savvy as far as it goes, but not to get too stressed. The mortality, again, they like to always give the worst case scenarios, that it's going to be 90%. That's the worst. Usually it's about 50% mortality, which is quite a high mortality. But of course, if you do get picked up early, you can get what we call supportive care, which can usually help to prevent you getting into problems.
My last question, as businesses continue to grow in Africa, and there's a large interest in investing in Africa, moving to Africa, and having a presence there as a business, how should companies and executives be thinking about health and looking after themselves as they operate in this particular environment?
Okay, first of all, I think that it's information. You have to know that you are going into an area which can have potential problems, including Ebola. It's not just there are many other very dubious and frightening diseases that you can pick up in all over the world. So I think it's a matter of just having general knowledge, knowing exactly what each country's problems are, getting with a prevention for that. The second thing is, I think we have to recognize that a lot of the problem with Ebola is the fact that there's not very good primary health care in these countries. And I think as a community, we have to start looking more at actually improving the general health of the populations as well, because if we don't increase the amount of knowledge and awareness amongst people in the countries, if we don't if there's not appropriate medical care in the countries, it's going to continue to spread, and a lot of other diseases are also going to be expressing themselves as well.